I'm actually going to go ahead and introduce everyone. Just a quick reminder that this session is going to be being recorded. Everything that we just talked about is going to be sliced out because nobody needs to hear about Aaron and I's crazy family life. So that's going to be sliced out. And thank you and welcome to our learning session on food insecurity, the face of hunger. Thank you again for being here with us today to learn about the work our presenters are doing to enhance equity in the district. I'm going to start with some introductions. For those of you who don't know me, my name is Estelle Aqua. I work in our Office of DEI. And we have a great suite of presenters for you this morning. So our presenters for this session include Lauren Nocito, the Director of Nutrition Education for our school district. Lauren has been working in the field of public health and community nutrition for over 20 years. And, you know, although nutrition education is important, we can't ignore access and systems that afford environments that promote healthy behaviors. And that is what Lauren and her team are going to be talking about today. And one really main focus is going to be for the Eat Right Philly team at the district to come here and lead this discussion for us. We also have Tasha Kavanagh, who was born and raised in Philadelphia and is a graduate from Philadelphia High School for Girls and Temple University. She's currently a program manager for Eat Right Philly, the SNAP Ed team within the school district of Philadelphia. She has spent her career of over 15 years in service to our young people and their families in our community, managing and implementing various health and wellness programming throughout the region. We also have John Barber III, who is Vice President of Strategic Engagement and Partnerships at the Fund for the School District of Philadelphia and a very proud alum of Central High School. This is his 6th year with the fund, and his responsibilities include championing strategic priorities and facilitating key partnerships while securing private funding to support the programming efforts of the School District of Philadelphia. We also have Keela Riley, another Philly native and Hannah graduate. Keela's passion for public health began as a policy council and executive policy council board member. She's currently a program coordinator for SNAP Ed, a shared food program, and has dedicated her time feeding families throughout the Philadelphia region. And last but definitely not least, we have Vicki Rossi, who is the distributions manager for Philabundance and their special programs. Vicki is another Philadelphia native. Our panelists are really holding it down for our city. This morning, she joined Philabundance in 2017 as the government programs coordinator after completing a master's in sustainable food systems at Green Mountain College, Prescott College. Currently, Vicki manages programming for Philabundance that is population specific or requires additional compliance. And her portfolio includes kids, seniors, prepared meals, and government programs. So I'm so excited to have this amazing group of people with us this morning. Before I turn it over to them, I'm going to put a link in our question parking lot. To our question parking lot, in the chat. If questions come up throughout the presentation, feel free to record it on the Padlet and we'll try to address as many questions as possible in our Q&A portion. If we don't get to all of your questions, we'll follow up with answers in our post-summit communication that's gonna go out to everyone. So I'm just gonna put our Padlet in the chat. You can use this to record any questions that you might have. Now I'm actually gonna turn it over to Lauren to get us started. Lauren, I'm gonna share my screen here so we can have our presentation up and ready to go. And just so excited to have all of you with us. All right, so now to you, Lauren. And
thank you, Estelle. And you got everybody from the waiting room, right? I think, John, you're in here now. And
yes, I believe I did.
Thank you. Thank you so much. All right, so we have a small group here today, which I think is a benefit to us. We're going to cover some different things today, but we also really wanted to have some time for discussion. We're all super passionate about this work, but we know there's a lot to do, and we appreciate feedback from teachers, staff, community members. So we're really looking forward to some discussion during this as well. So you can move on to the next slide, Estelle. So I really wanted to highlight the fact that the group together today is really collaborative and super supportive. And I not only have a really good time working with all of these people today on the call, but they are really passionate about this work and making change and really addressing some of the root causes that we see when it comes to food insecurity and hunger in our community. So we'll give them a chance to talk today too as well. Go ahead, you can move on. So today we're going to be covering, starting off with just defining food insecurity, looking at root causes, really talking about structural racism a little bit. We're going to get into some courageous conversations, as we call them today. So we do want people to feel welcome in sharing thoughts and ideas. We're also going to talk a little bit about the data, what we know about our students and families within the district, and then also cover the collaborative efforts between the fund, Share Food program, and Fill Abundance out in the community supporting our schools. And then hopefully we have some time for some final thoughts at the end. Next slide. So this slide and this information is really something I love, and I took from the Office of Teaching and Learning. So I stole it from them. We're calling some of our discussions today courageous conversations, really. So I think it's important for us to kind of look at these points here and establish some group norms before we get started. So number one, we begin by listening. Number two, it's okay to make mistakes. From challenge comes change. Number three, there are perspectives in the room other than your own. Number four, the strongest solutions come from the process, not from a single moment at the end. This conversation will be unfinished today. Number five, your words have power, so consider their impact on others. Number six, if something hurts, name it, say ouch. And number seven, suspend judgment, seek to understand. And number eight, there is a conversation in this room that only these people here at this moment can have. So let's find it. So I offer these to you. Please steal them. Please use them in your own conversations. I really think they're powerful and helpful when you have tough conversations. So I'm going to turn it over to Tasha Kavanagh, and she's going to get us started with food insecurity and root causes.
Thank you so much, Lauren. Good morning, everyone. Thank you so much for joining us here for our discussion today. As Lauren mentioned, we are going to dive a little bit deeper into the root causes of food insecurity. So it might be a little bit uncomfortable. So thank you, Lauren, for kind of going over some of those, I guess, pillars of for our discussion today. If we could, Estelle, could you take us to the next slide, please? Thank you so much. In order for us to have, or to dive a little bit deeper into this discussion about food insecurity, we need to understand what food insecurity really is. So we have definitions of what food insecurity is versus food security. Most people, may think, well, I'm secure, you have food available to you at all times, physical, social, and economic access to sufficient, safe, and nutritious food that meets your family's dietary needs and your food preferences, versus food insecurity, where there's limited or uncertain availability of nutritionally adequate food for your family, not knowing where you're going to acquire it from, if it's acceptable or socially, if it's acquired acceptable foods or socially acceptable ways. So just kind of keeping those definitions in the back of our mind as we, go through this discussion about what food insecurity is and the root causes of food insecurity. Just also keep in mind that food insecurity isn't something that just happens on its own. Food insecurity is, I guess, an effect of certain causes, certain structural impacts that impact our families and can lead to food insecurity.
And it can happen to anyone. It doesn't just mean that it's someone who, are really socioeconomic challenged or live in neighborhoods that might not be, or neighborhoods where we think typically you might see food insecurity. It can happen to anyone. As COVID has shown us, food insecurity can happen. We're all just maybe a few paychecks away from being food insecure. Estelle, can you switch the slide for me? Thank you so much. Here's a quote by a woman, Karen Washington. Some of you may have heard of her, might be familiar with her work. She is an advocate, an activist. She lives in New York, and she's an urban farmer and believes in community gardening. Here's a quote from her. She said, "What I would rather say instead of food desert is food apartheid, because food apartheid looks at the whole food system, along with race, geography, faith, and economics. You say food apartheid and you get to the root cause of some of the problems around the food system. It brings in hunger and poverty. It brings us to the more important question: what are some of the social inequalities that you see, and what are you doing to erase these injustices?" So that's what we're going to kind of talk about today. We're going to get to the root cause and just have a brief discussion. Then we're going to open up to you guys just to kind of give us some feedback about what you think the root causes of some of these problems around food systems, why they occur. Next slide. Thank you so much. So I'm going to pose a few questions to the group here to start us off on our courageous conversation. And please keep in mind, like Lauren mentioned, we want to be comfortable with speaking the uncomfortable, but we want to remember those pillars of having a nice, comfortable conversation. What do you think the root cause of food insecurity and food apartheid are? Would anybody like to come off mute and share their thoughts about that?
I can share. So I think when I think of food insecurity and food apartheid, I think about really the acquisition of our country. And it took me a while to really understand how deep rooted that is. I read Black Indians over the summer. And in that text, it really talks about how there was a struggle for land in this country, and about how colonizers would come and they would find these communities where Africans and indigenous people were, and they would literally burn crops as a way to steal land and take resources. So I really think it goes to the root cause of this country. And I remember I was reading Frederick Douglass and talking about how food, or the lack of food, was used as a weapon against enslaved children, and about how the access to having that was used to control as well, having food who didn't have food. So I think it really goes to the founding of this country and this idea of who's worthy to have the things that they need.
Thank you. Very good point. And we'll talk more about that. Since 1616, when Africans were brought over to this, country, and how they were treated. And then after the Emancipation Proclamation, 1865, when the last states got word that they were free, just how a lot of policies and laws that were implemented still kept the Africans enslaved, so kept them enslaved in a way. So you make a good point. They did use food and access to food as a way to continue to control a group of people. Next question: what is the child student perspective of hunger? Anyone have any feedback from what they're seeing in the schools or in their work with children directly in the field or in the schools? Would anyone like to speak to what they're seeing and what your perspective is?
Sure. Good morning. Good morning, everyone. So I want to go back to the first question that you asked, Ms. Kavanagh, which made me think about how people generally define food insecurity. Like people think about, people not having access to food, but I'm thinking in 2022, and I'm glad that Ms. Balbuena, Principal Sheridan, is joining me here. It's different. Our school is situated in one of the poorest zip codes in the city. And it's very subtle how that insecurity manifests. We think about food insecurity more of a lack of access to nutritious choices and lack of access to just to that unavailability around the neighborhood for around like vegetables and things like that that you would think for us is easy to get to, not so much within like at least the Kensington area where we are. And I'm thinking about sort of the, is this more of a macro policy solution rather than an advocacy effort that would yield to that? And what makes me think about that is around, we are schools, but we're also responsible to providing food for our students, right? And those policies about what we serve come from the USDA, right? About what kids get on a daily basis, and through that we are creating habits of mind and healthy eating habits or unhealthy eating habits. And I look at what we serve to students on a daily basis, and it breaks my heart. I would not feed that to my child. I don't have children, but I'm saying that what we have, it's like, I think of nutrition as the other mountain to climb in education that we sometimes think about, but we don't often think about enough to make a change. And how it manifests in our school is kids who will feed or eat anything that you give them. Literally, anything that you serve them for breakfast, they will eat. And they won't question whether that's healthy or not. And it manifests as a matter of survival. Like, I need this to have enough energies to stay awake in your class. Whether that is purely sugar and just fats, and it's the most unhealthiest thing that they can eat, that's not in their, that's just not something that they're concerned with. And then we look at, we do this on a daily basis with our students, and we call that feeding them. And then we expect the best of them with academics. So that's what it looks like in our school. It breaks our heart to provide what we have to provide for them on a daily basis. Just I'm not sure if Ms. Balbuena would like to add more to that, but yeah.
Thank you so much for sharing that. And you're so true. With nutrition is directly correlated with test scores, with a child's ability to be able to focus, to have the energy to make it through school, through the day. So nutrition, we're hoping that we can get to a point where nutrition is an important part of the conversation when we're talking about educating our youth and our children and students in the school district. So thank you again for sharing that. What are some differences that we see at each school or neighborhoods? Do we see differences? Would anyone like to share what they're seeing in the neighborhood or schooling that they are where you're working in?
Sure, I'll share. So as many of us have, we've been bounced around the district a lot. So the school that I currently work at has a satellite lunchroom. So therefore, like they're limited on what food they can provide to students. Where I've been in other schools that have state-of-the-art kitchens and fresh food as opposed to a heated meal that has been microwaved over and over again. Clearly shows that there are differences. We look at the neighborhoods. Our last colleague just spoke about his experience in Sheridan being one of the poorest zip codes. Clearly there is not a clear, consistent source of food for our children.
So true. So true. Thank you so much for sharing that. And last question, some of us on this call, well, not a question, but just a statement. Some of us on this call may not have ever experienced true hunger like some of our students do. So we just want to kind of keep that in mind. And when we thought about the title of our presentation, The Face of Hunger, we're talking about our students. We're talking about each child that we come in contact with, what they're experiencing. We don't know. We might not know. But there are some signs that we're going to talk about later in our discussion of what to look for, what we can, keep an eye out for as clues, as little hints as to the face of hunger and what it looks like. Also want to keep in mind that children, these, the structural racism, it impacts our children as well. It not only impacts their parents, the caregivers, but it impacts them equally as much. Thank you so much. Estelle, can you move us to the next slide, please? So we're going to talk a little bit about structural racism at a glance, and we're going to go into our next slide where it says structural racism. As you can see, this diagram shows the 5 main pillars of structural racism. We're talking about housing segregation, which was created, many years ago, and keeping folks impoverished. We're talking about the racial wealth divide, employment discrimination, over policing, and we're also talking about discrimination in healthcare. When we're talking about these 5 pillars, we see them occur in different ways. But most people you'll ask and they'll say, oh, I experienced this in my everyday life. So, a lot of these, or a lot of folks on this call may be able to identify with some of these instances of structural racism. We're going to take a little bit of a deeper dive into each of these 5 pillars, and I would like to leave some time for discussion. So I'm going to try to keep my, this dive a little bit abbreviated. Can you move us to the next slide? Thank you so much. Structural racism is noted as historical, cultural, institutional, and interpersonal system of hierarchy that routinely subjects BIPOC to cumulative and chronic inequities. It is a system in which public policies, institutional practices, culture, interpersonal relations, and other norms reinforce racial inequities among Black, Indigenous, and other people of color. Thank you. So let's dive into this. Let's talk about the housing segregation. 1 in 4 African Americans and 1 in 6 Latinas live in an area of racialized concentrated poverty. Redlining occurred. It occurred years ago after slavery was ended, and it still occurs now. Predatory housing contracting, systems and lower poverty values and home equity still happening to this day. Dietary related health conditions related to where you live is disproportionately high among BIPOC residents of our communities in Philadelphia. It also correlates with environmental racism, dumping toxins and air pollutants into our air and water, leading to higher instances of respiratory illness amongst our children that typically shows up as asthma, homelessness, or lack of adequate or stable housing. We may, encounter children or students who are living on someone's couch, who don't have a home, or who are in a shelter. These are things that are disproportionately at higher rates in our communities in Philadelphia. Next slide, please. Thank you. We're talking about the racial wealth divide. BIPOC have little to no emergency fund. These are facts. Financial cushion. They have less to no liquid assets. And it stems from a lot of, again, this cultural racism, not cultural racism, but structural racism, where policies that have been set into place since slavery, since before slavery, since our founding fathers came and founded our land. And I say that in quotes, it is something that we've been dealing with for many centuries. Single income families with women as head of households. We see that often in our communities here in Philadelphia and with our students within the school district. BIPOC women earn less than white men, white women, and BIPOC men. And you know, you think about that for a minute, let that sink in. If women earn less, BIPOC women are earning less, but yet they're the ones leading these households. Just think about how that impacts a person's ability to feed her family. You know, sometimes you have to make a decision. Do I pay this bill or do I feed my children? You know, so we got to think about that for a second. Unemployment discrimination, lack of paid time off or sick leave. We find that a lot of BIPOC families work in frontline industries, such as healthcare, as home health aides. They work in customer service, working as a cash register or working, you know, on those front lines in hospitals, in stores and grocery stores. But they don't oftentimes, because they're working on a part-time basis or the employer doesn't provide sick leave. So when they get sick, they lose money. They don't have paid time off. And that, in fact, will impact their ability to feed their families. Disproportionately working in jobs that are the lowest paid in the US. Higher unemployment and underemployment rates. Discrimination in healthcare. We can also, you know, talk about how racist attitudes persist among healthcare providers. You go to a doctor and you don't feel comfortable, or you don't feel like you are being heard or you're being seen. You don't feel that, you know, the doctor is truly listening to what you have to say or really sees you as a patient with true medical concerns. There's lack of access to adequate health insurance or any insurance at all. As we mentioned before, most of our frontline earners don't have that as, they don't have insurance as part of their job package. Receiving subpar medical care and attention and follow-up treatment. We also see this discrimination occurring when they're encountering longer delays in the hospital waiting rooms or in their medical practice waiting room. Oftentimes you have less practitioners, 1 or 2 doctors that have to treat a whole community of patients. So it reduces the time that a doctor has to spend with each patient. Therefore, the patient not really getting the health or access to the healthcare that they should be getting. And all of this leads to an increased likelihood of being food insecure. And then we're talking about over-policing. I left this blank because we just are rolling off the hills of the George Floyd incident, you know, that's still fresh in our minds, and over-policing and how that, you know, with killing Black men, racial profiling. I think it's just really evident when we say over-policing and how 10 times the rate Black men are incarcerated at 10 times a higher rate than white men in America. And America has the highest rate of incarceration throughout the nation. So all of this impacts a family's ability to provide food and to feel that they are secure in providing adequate food for their families. Next slide, please. And this will lead us into a deeper conversation. Now that we were able to kind of highlight some of the ways that policies and systems have impacted a family's ability to provide food for their families, we can kind of dig a little bit deeper and kind of talk more about what that means. So first question, what preconceived ideas or assumptions are made when we think of individuals that may be affected by hunger? I know sometimes even myself, we have preconceived notions, we have biases, and it comes off sometimes when you're thinking like, well, why are they food insecure? Well, why do they need this box or this produce box? You know, we've got to put all that aside and really think about, you know, the underlying structural racism that is there. So I open the floor, I open up. Please unmute yourself and share out what you think about any preconceived ideas that you may have had as working with children, as, you know, someone, as a teacher, as a principal, if you'd like to share.
Yeah, Tisha, I would like to share from the parent perspective. And what I read an interesting article. I guess one of the preconceived notions or assumptions that folks with food security or more economic privilege may have is that our personal choices don't actually contribute to this inequity. And so one example, I actually recently read an article that if more people, especially more people with economic privilege, participated in school food programs, the quality of the food would actually increase because we'd all be able to collectively advocate for better schools for better food for our young people in schools. And so when we say things like, well, my kid can't eat that, or my kid can't go to that neighborhood school, that's not good enough for my kid, it's actually some of our personal choices that contribute to the system functioning in the way that it is. So it sort of becomes a chicken and the egg, right? Some of us can opt out. And so for those of us that can't, the low quality continues to perpetuate itself. And it's really made me think of, from a parent perspective, the types of systems and structures that I'm participating in and opting out of, right? Who says that this food is not good enough for my child, but it's good enough for other people's children, right? And that's deeply personal work that I have to do as a parent who cares about all children and cares about my child and thinks my child is the most precious child, right? And so I just appreciate this conversation about a lot of times what we do is we say the system, but we're all part of the system, and the personal choices that we make, unfortunately, can perpetuate inequity. So thank you so much.
Absolutely. Thank you so much, Estelle. And that's a wonderful point. It's not one of those 5 pillars of structural racism, but you're absolutely correct. Our personal preferences, we kind of, like you said, the chicken or the egg, and we kind of perpetuate that when we don't, send our children to the neighborhood schools, when we send them out and bus them to other school districts where we feel that, they will get what our personal preference, what we would like for them to have. We do have to provide a little bit more support, or we could provide more support to our local community schools and in the district. So thank you for sharing that. Anyone else have anything else they'd like to share or comment?
I have something, Tisha. Excuse me, it's John Barber. How you doing? Good morning, everyone.
Good morning, John.
Being able to work with you guys, and I can't wait till I get to my section, because now this has been so filled with information, so already. I mean, it's kind of taking me, I'm getting overwhelmed with some of the thoughts, because I'm thinking about the things we've seen being on the front line, being able to experience working with you and share with some of the projects that we've been able to create. Being on the financial side and being on the development side and having to have the conversations with people who you want to be potential donors. It's interesting to hear when we talk about preconceived assumptions about where hunger comes from and why. And it's almost like people think sometimes that this is a choice, that people choose to be, like it's only assisted welfare families who are experiencing this issue. You chose to live in the area. You have a choice to get out of this certain community. I'm a proud product of Philadelphia Public Schools myself. I've been a part of those schools. I graduated from Central High School later on, but in the beginning stages, there were some schools that I was attending that weren't so fortunate to have some things like you talked about, a full kitchen, these satellite kitchens. I've been a part of discussions with schools who are looking, almost begging to have full kitchens installed. And we're talking, when we met with Capital, we have donors who want to give to the construction, towards construction of a campaign to do something like that. But either we are waiting to find out what's going to happen with that school because of enrollment. There may not be enough students in that school. And this school might be one of the schools that might be targeted to be either combined with another school or closed altogether. There's so many levels to some of the decisions that the school district is making right now that the outside is not informed of. So when I say assumptions, I'm thinking about, this family has issues and it's from the community, and this community is ravaged with drugs, or they choose to be here. These are assumptions made by so many people that could potentially get involved. The more we engage people and then inform them, they'll want to get involved in the correct way. That's the way I look at it. That's the way I try to approach when I go and give my speak to potential donors, whether they be corporate or individuals.
Thank you, John. Yes, and you make a very good point. Thank you so much for sharing. For sake of time, and we do want to share some data that our district-wide survey shared with us. We're going to get to the next questions. We'll save those for the end of our presentation. So I'm going to pass it over to Lauren for her to kind of talk about what we know about our students and families. Thank you so much.
Yep, and I'm gonna breeze through some of this because I know there's a super helpful and super detailed memo that I'm gonna give a shout out to Erin McCross, and I know she's on the call listening. So she is from the Office of Research and Evaluation that's really been helping our nutrition team in Eat Right Philly lift up and make others aware of the fact that food insecurity and these challenges are affecting our students in so many different ways. So I just want to note that the district-wide survey does actually, in fact, ask some questions. There's 6 questions that are on the parent guardian survey that gets to food insecurity in the household. So there's an example questions there. And then I'm going to ask Estelle to move forward here. There is some limitations. We know that a lot of parents aren't taking the survey, so there's definitely likelihood that these accounts of food insecurity are underestimated in so many cases. We also know that Black and African American households, and especially students in high school, there's underrepresentation among survey respondents there. So we're probably missing out on a lot of information, and this information is underreported in some cases. We can move on. We do want to note that the school district's rate of food insecurity is much higher than for Philadelphia in general, for Pennsylvania as a state, and also compared to the national average. Next slide. Oh, Estelle, can you move? Okay. And then here also we wanted to note that both Hispanic and Latinx and Black and African American families and households are disproportionately affected by food insecurity. So this is of special note, and just looking again at the students across our schools and facing at this point in time, and in many cases. You can move on. The other thing too, I know there's some school staff on the presentation too, but we do also ask principals, and there's also a similar teacher question that asks about food insecurity and its challenge to student learning. So a good percentage of our principals are answering that this is a great or a moderate challenge for our students. So we are acknowledging the fact that this exists, and we need to lift this up and also figure out ways to address it. So I'm gonna skip forward, Estelle. I'm going to drop the memo to more information, and we also welcome more conversation around this. Our office is always talking about this, so we welcome feedback and comments to this work as we figure things out too. We would love collaborators from the school side to help us with this, but I'm going to move forward so we can get to both John and Vicki and Keela. I don't want to miss out on their information. You can move forward again. All right, so collaboration, supports, and resources. John, I'm gonna give you a couple minutes, and then we'll move into Keela and Vicki too as well.
Yeah, thank you. And I'll be brief, but I want to touch on a couple things. Good morning, everyone. Again, I'm John Barber. I'm the Vice President of Strategic Engagement and Partnerships for the Fund for the School District of Philadelphia. And the fund is an independent 501c3 who identifies, we coordinate and connect the philanthropic resources to try to level the playing field in the public schools. So we work as a liaison between the school district and potential corporate and individual donors. So knowing that our school district is over 90% above the poverty level. When aligning potential partners with the school district, we recognize the needs of initiatives such as hunger, and we generally use these 5 phases related to partnership management. So number 1 being outreach. Our office is in communication with and works collaboratively with the Office of Strategic Engagement, who at times provide referrals. They contact minority business enterprises and corporate partners in their database who are candidates to get involved. The Office of Grants Development is kept in the loop in the event that they may have connections with the community organizations or info on city, state, or foundation funding that could be available. And to fund ourselves, we rely on current and former donor data, school district and Philadelphia alumni, which is something we're really trying to establish now, connecting with them, and communications with the various chambers of commerce in Philadelphia. I want to stay on that last slide, please, for a while, because I'm just touching base on each one. Thank you. Cultivation, this process speaks to the team collaboration, identifying school needs, speaking with principals, Department of Nutrition, in this case, hosting partner presentations and or school visits if needed, and the beginning phase of creating partnership agreements. We go into planning, the planning scope. This relates to what form of giving the identified partner wishes to contribute, whether it be via providing volunteers, in-kind donation, cash donation, scholarships, internships, or managing fundraising events to help us towards our goal. Engagement is also really about implementation, involves behind the scenes coordinating, scheduling dates, collaborating with relative school district offices and partnering organizations like Share, Eat Right Philly, the principals, and school leadership or associations. And then acknowledgement generally deals with promotional planning and logistics, working with the Office of Communications or partner public PR organizations to help ensure the proper acknowledgement, and announcements are made through branding, press coverage, and live presentations when appropriate. So next slide, please. These are some of the noted examples of projects we're addressing hunger that we've had some success with. And Dunkin' Donuts with cash donation, meaningful meals being the project, working alongside with, Department of Nutrition at the school district, of course, Eat Right Philly. Tobias Harris Charitable Fund with the Holiday Drive, Turkey Holiday Drive. Beambo, working along with career technical education, providing scholarships, career pathways. So in summary, the fund partnerships with School District Philadelphia and seeks to promote equity. And that's one of the things we talked about: equity, improve performance, to create 21st century learning environments where all students can succeed. The lack of economic equity, resources, education, health and wellness resources, including trauma and healthy eating and exercise, equals control. And to go back to a statement that was made earlier. So thank you all for what you've been giving so much and allowing me to be on the front lines with you guys and see where the dollars make sense. That's what I always tell all the donors. Until you get out there, then you see the real need and see how your dollar really implements. Thanks. I'm gonna turn over things. I think it goes to Cher now. I pass the mic.
Thank you. Thank you for that, Mike. Good morning, everyone. My name is Keela Riley. Again, I'm the program coordinator for SNAP Ed at Share Food Program. If you haven't heard of Share Food Program, we are an independent food bank founded in 1986 that serves communities in need of food. We have a few programs to help us do that. We have our Philadelphia Pantry Network, our Delaware County Pantry Network, and Montco Hunger Solutions as well. They're some of our primary methods of feeding Philadelphians, and they're spread over out of 3 counties, totaling over 100 partners. And these 2 or 3 programs alone actually deliver thousands of pounds of food to residents facing food insecurity. We have the National School Lunch Program, which Share is the only nonprofit organization that holds that contract. That feeds over 300,000 children in nearly 70 schools across our region as well. And we have our Senior Food Box Program that delivers over 1,000 boxes of food to seniors in need, roughly around 6,500 seniors. We have Philly Food Rescue, which is an amazing program. A lot of food is, for lack of better words, wasted. And Philly Food Rescue does an amazing
Keela, you got muted.
Came I back? Can you hear me? Yes. Yes. Thank you. Okay. We have our Nice Roots Farm, which is a 1/4 acre farm on a shared premise. that grows food all year round, or as long as the weather will allow us to. And that donates foods back into food pantries. A lot of that food goes to seniors as well. It offers a level of education for people in the community to come out and get some farm education and learn how to start urban farms in their community as well. And then we have SNAP Ed produce distribution, which is my program. Can I have the next slide? Thank you. SNAP Ed's main focus is feeding children and families. We distribute to over 14 schools, around 700 families monthly. Around 7, maybe a little bit more than 700 actually. Our program, and we are growing, our program consists of us delivering 10-pound boxes full of fresh fruits, vegetables, produce into the hands of families and children at schools across the Philadelphia region. If you have any more questions, definitely put them in the chat box and I'd be ecstatic to answer them. I'm going to turn it over to Vicki at Philabundance.
Hi, everybody. At Philabundance, I guess I was just focusing on specifically what we're doing relative to working with children and school district. We are primarily working, we service 9 counties in Philadelphia, New Jersey. And our primary focus is really something that the school district identified as interested in closing the school meal gaps when schools are closed over the weekend and for longer holidays where there isn't access to school breakfast and lunch. And then the other objective we're really focusing on is to provide consistent food access to families with children. We're doing that through a number of ways, and we're trying to really talk to each individual school that we're working with so that we can figure out what's the best way for those families and those children to receive food. So one of the things we're doing is providing a backpack that sort of replaces the school breakfast and lunch. It looks very much similar to it. It's 2 breakfast items, 2 lunch items, 2 snacks, 2 milk, 2 juice, that kind of thing, so the kids can take them home over the weekend. And then for longer breaks, we're doing additional distributions at schools, distributing anything from produce boxes, a pop-up pantry, a dry pantry box, or pre-made family-style meals. Other than that, on the second objective, provided consistent food access, we're looking at produce distributions at schools, assisting with school pantries, either helping them stock those pantries or helping them start those pantries. And then in addition to that, we have, we're launching a healthy snack program. So we'll be offering schools and organizations that work with children access to free healthy snacks that they can distribute during after school programming or wherever they need them throughout the day. Next slide, please. And then in our 9 county service area, we're working currently with about 50 school district of Philadelphia schools. We've identified them through a priority list that the school district has been working with us on. And then other schools that have, we've worked with in the past, or those that have reached out to us directly for assistance. And we're always open to adding on more schools and additional programming ideas or ad hoc requests if there's something specific that we might be able to assist with in the school that will kind of get them over the line, I guess, to have more food available for schools. So we are expanding our program, as I said, to organizations that work with kids outside of schools, such as like City Year or PAL or the Delaware Valley Fairness Project, who does a lot of work with schools. But again, we're opening to adding on new partners as it makes sense.
All right, I know we're at the end of this. I want to thank John Barber, Vicki Rossi, and Keela Riley for their time. They have been amazing partners with Tasha and I as we navigate food insecurity within the school district. I want to acknowledge everyone's comments too about food service and school meals and some of the challenges that come with that. We are separate from food service, but work very closely with them and are trying to help and support and be advocates for healthy meals within the schools and looking at how that's provided, even the atmosphere in which students are eating in the cafeterias or in their classrooms and things like that. Since we're out of time, I dropped some different links into the presentation. So this information here about city supports and resources, there's a really excellent handout that you can use, post on your school's website, share with families and community members as you see fit. And there's also a call to action document with some information on how to become more involved in food insecurity and this conversation. Both Tasha and I welcome you to email us. We are always open to having conversations, especially with school staff. I know we've been out on the ground, especially Tasha too, so much this year, having conversations with school counselors and nurses and principals about how we can best support and bring both share and or fill abundance into these schools and make these distributions the best fit for your parents and families and guardians that you're working with. So I want to turn it back over to Estelle. I'm sure she wants to close this out. Thank you again for coming and for the conversation today. We definitely didn't have enough time, and we welcome more conversation around this.
Yes, when you are having a great conversation, there's never enough time. So just want to thank our panelists here for all of the information that you've shared with us, as well as ways to get involved. Please show some love for our panelists in the chat, everyone. I know that some folks may be going to their next sessions. I want to drop some resources in the chat. We have a survey to start off. So if this is the only session that you're attending, please take a moment and fill out the survey that I'm going to drop in the chat to help us better plan and facilitate learning opportunities. If you're attending the next session, we just ask that you wait to complete the survey until after the second session. So let me just go ahead and drop that in the chat for everybody. And just want to thank everyone for joining us this morning. Hope you have a great and restful and service-oriented Martin Luther King Jr. Day of Service. And I know some folks are here for our next session. We're going to go ahead and start that in a few minutes. But for everybody else, you are free to join your next session and have a really, really great day.
Estelle, could I add something to that? I just want a second.
In a minute, is that okay?
Yes. Yeah, sure.
Go ahead. Yes.
Oh, okay. I just want to second what you said around just thanking the panelists for raising this issue, especially within the school district. One thing that I wanted to share from my perspective as an administrator in the district is that we see redlining still happening. It's very much alive, except that now it's only happening around schools, and standardized scores or test scores are the vehicle that enables that. Mm-hmm. And we're seeing that happening around our school. And I know, again, I say my principal, Ms. Balbuena, is with me in this conversation around, just creating more awareness around that with policymakers. The question that we keep asking ourselves, why is this happening? Why is there food insecurity? Why is it so much easier to find a bag of methamphetamine and buy it within Kensington than it is to buy a bunch of broccoli? That's problematic, and we know it's a policy-driven issue. So creating more awareness around the policymakers who can, have a say in this and have some effect in this. It's something where we, I think, as educators are willing to contribute with the stories because we see them and we live them on a daily basis with our families. But I just wanted to, appreciate all the collective efforts. And I know in some cases we are working with each of the individual organizations that presented and really do make a difference in the lives of our families. So thank you for that.
You. Thank you. Thank you so much. That was a great ending word for all of us. And if you are going to your next session, I put a link in the chat where you can find your next session. And I'm just grateful to all of you for showing up this morning on your day off. And we will see you soon. And if you're here for the next session, go ahead and hang on. We're going to get started in a few minutes. Bye, everyone.
Bye. Thank you so much for having me. Thank you.
Yes, thank you.
Thanks for having us.
Thank you so much, Tisha. That was great. Thank you.